We are close to episode 30. Not sure, we lost count. We're getting ready to reopen within 10 days, hopefully. We just want to let you all know we miss you. We look forward to seeing you. I think that you guys are eager to see us as well, from what I can tell with the schedule. We will keep social distancing. Our lobby is plenty large to have enough people in there at least 6 feet apart. We've got hand sanitizer everywhere. We will wear masks, and you can wear masks if you want to. The doors will be propped open so you won't have to touch anything. We will probably be taking your temperatures as well as all of our team's temperature, just to make sure nobody has a fever that we can address or not risk infecting anybody. But anyway, we're super excited to get back. Today, we are joined by our expert dermatology doctor, nurse practitioner, Hope Mers, and Karen Lynch. We're going to talk about something that I always have, hear you talk about it. Hope, you've never talked to me about it, but I've got a little rosacea. Years ago, I had a little treatment, but I need another treatment. I was just looking the other day, and I think it's flared up a little bit. But so we're talking about a condition called rosacea, and Hope is going to tell you about it medically and also what we do for it. So I will turn it over to you, Hope, and I will try to help you get your slides up in a moment here.
All right. So a common complaint or question that we have amongst patients, staff, family members, everybody is redness. So redness in the skin tone. It can be caused by a few different things. One of the most common conditions is called rosacea. So rosacea is something that, as Dr. Mendelsohn mentioned, I struggle with. It's a pain, it's hard to treat, it's annoying to treat, but it is treatable, and there's different things we can do to help with our redness and help prevent it from progressing, which is a common effect. So typically, rosacea starts very mild, and it can progress throughout the years and become more and more severe. So you do want to make sure that you've got a good hold on it and that you're doing things to help treat it and prevent flare-ups so that you can have your best outcome possible and reduce your redness in your skin. So first, we're going to go over a little bit of rosacea and the different types that come along with it. In this slide here, you can see that young woman on the left-hand side, she has just a little bit of red tone to her cheek, and that's very common in the typical type of rosacea. It's a very long word called erythema to telangiectatic rosacea. So this typically starts like a redness. You'll see a flushing when you're working out, when you have exposure to certain types of what we call triggers. So typical things that trigger rosacea, and if you Google this, you'll see a huge long list of a million different things. But some of the most common are like working out, as I said, sun exposure, chocolate, citric-y, kind of acidy foods. Alcohol is a big one. So some people say, if I drink a glass of white wine, my face just turns red, purple. And, I know I like red wine, and certain other alcohols can make my face turn super red. And so I avoid them. But avoiding certain triggers can be helpful. The other things that are important to consider are your skincare that you're using. So someone with rosacea typically does have a more sensitive type skin, so typically does run a little bit drier, and so we want to make sure that we're targeting that dryness with extra moisture to compensate. Also, anti-inflammatory kind of topicals. So we carry some in the office. My favorite is Elastin Nectar. It has a lot of different antioxidant properties and anti-inflammatory things in it that are going to help calm rosacea as a maintenance treatment at home. So that's kind of important. Going forward, you want to make sure that you have sunscreen to prevent that UV radiation from increasing the redness in your skin tone. So we typically recommend what's called a physical sunblock. This is going to be mainly zinc and titanium, and that will help prevent that UV radiation causing mutations in the skin and aggravating the redness. Now, over the years, and in that slide that you saw before, you would see on the lower hand side that there's a woman with these little vessels forming on her cheeks. And over years of having redness and flushing episodes, that is typically one of the more end results. You have these little vessels that are on the cheeks, and that does require treatment with a laser. So there's no topical cream or any kind of facial treatment that will reduce those unless it's some kind of laser. We use an intense pulse light, and that is going to help burst and kind of re-bruise almost that redness, those little vessels, so your body can reabsorb that blood that's sitting there. And repeated treatments of that does help reduce those vessels. Now, if you let them get to a point where they're so bad, it's really hard to turn them back, but we can always improve them. So make sure that you come in and see me or Dr. Mendelson, see one of our team members, and we'll get you on a regimen, a treatment plan to help reduce those over time. So that's important with your main subtype of rosacea. In another slide, I think we do show Hillary's treatment with that IPL, if you want to play that. So that's a scar on her leg. I just happen to have this video, and it shows that it's just an easy pulse of light. It's not painful. Afterwards, you have no evidence that you had anything done. You might be a little bit pinker that day and the day afterward, but really that's it. And it takes 5-10 minutes, if that, to do the full face. So super easy treatment. Typically, we start with 3 of them in a row. So we'll do you know, May, June, July, or whatever. And then we maintenance treatment for the rosacea to keep it calm. So this light treatment helps keep that inflammation down. It's awesome. It's really good for rosacea. I use it on myself every few months to maintain my redness. So if we move on, we're going to see a different subtype of rosacea called Papulopustular Rosacea. This is more involving what looks like acne, but it does not act, and it's not treated like acne. So typically you'll see the redness in the classic rosacea areas, which is the cheeks, the nose, the forehead, a little bit on the chin, and it's bumpy. Those bumps look like acne bumps, but if you put acne gel on there, like a salicylic or a benzoyl peroxide, it's going to burn and it's going to make it worse. So we want to make sure that we use something that's going to be targeting the actual rosacea. And there's prescriptions we can utilize in the office for you, depending on what it looks like, depending on how involved it is. Obviously, you've got this mild one on the upper side, and then you can see a much more severe flare-up. So the mild, we would typically go with a topical cream, prescription-wise we could do, and in conjunction with some good skincare and IPL treatments that should help that shut down. The girl with the real severe on the cheek breakouts, that would typically require an oral antibiotic, low dose or typical dosage to help calm down that inflammation and shut that down. So that's a short-term kind of thing we do to treat flare-ups, and then we get you off that antibiotic. So it's not going to be, you know, a long-term kind of thing treatment-wise. But that kind of sums up the papulopustular. Typically, you treat it the same way as the normal red rosacea. You just might need to add some prescriptions to help with those acne-like bumps. So if you want to go to the next slide, Dr. Mendelson. So there is a blown-up picture of something called Rhinophyma. So this is a subset of rosacea that is typically later onset. It's more common in men than in females, and it's usually age 50 or over, but I have seen this a few times in 30-year-olds, even 20-year-olds, actually, the beginning stages of it, where the tissue in the nose is overgrowing. So you see some hypertrophy of some sebaceous glands and dermis there that's just overgrown. It looks kind of lobular, bulbous. The nose just looks larger than it used to be. And that does continue to worsen over the years unless you're treating and you're maintaining your rosacea flare-ups, your inflammation. So definitely we want to get someone like this on a skincare regimen, including probably a prescriptive topical. We also want to reduce the surface texture along with the kind of size of that bulbous nose. So there's a few different ways to do this. I know Dr. Mendelson can go over a surgical option, but also we can do what's called a dot laser. So a CO2 resurfacing laser can be useful to treat a condition like this. It's kind of heating up these columns in the skin. So it heats up these columns, hundreds of thousands of columns wherever we're treating. Those columns will burn out and the skin cells in there will slough off. The column heals in tighter, reducing whatever we're treating. So in this case, it'll be the surface area of the nose, and it'll help for a smoother texture. Multiple treatments are probably going to be required with that, but that's a good option there for him in particular. I know Karen Lynch was mentioning Dr. Pimple Popper treating Rhinophyma on a man on one of her episodes, and she used cautery, which is like a pen that's hot, and you know, it has a tip that is the size of about a pen, and we can go around the areas that are raised and heat burn them kind of down repeatedly to create a smoother appearance. Did you want to add something, Dr. Mendelson?
Well, just while you're bringing it up, so I'll just tell you, so back years ago in the 90s when I was training at the VA at the time in Syracuse, we were, so we would see a lot of men with Rhinophyma, and the way that we treated at Hope was, so at the time we would, in the operating room, under anesthesia, okay, imagine this, you know, everybody's in their COVID garments these days, right? We're all protective gear. So we'd have our shields on and everything. Why? Because we used to use, so we talk about microdermabrasion, but we used to use dermabraders. I mean, imagine kind of an electric motorized sander, okay? Basically, we would localize the area and we would go ahead and remove that tissue with this instrument. And I mean, honestly, it was a mess. There's blood all over the place, all over everybody, and what you're trying to do is just take that tissue down. So we don't do that any longer, and Hope mentioned two things. So one, it might have been a bifurcator, or it might have been a subject cautery. There are a lot of ways to destroy some of that tissue, which is what you want to do. It's actually a skin element, right, that's overactive here. We do commonly use, I'll use the CO2 laser, so will Hope, with regards to Rhinophyma. And so we're using laser energy to basically ablate or destroy that tissue. The benefit is it's much different. You come in, sometimes just with topical, sometimes we'll localize it, but sometimes all we need is topical, and we'll lase it. But the nice thing with the laser is that things don't bleed. And so you're literally just in control. You're just kind of coming around almost as though you're sculpting something, and it's kind of funny, but that's sort of what we're doing. And so we're destroying that tissue. And just like we will with, you know, photoaging and, you know, using the CO2 laser for hyperpigmentation or acne scars or other problems, we will do some of those same things. And so then you'll have ointment over that area, and over the next 4, 5, 6 days, things will heal up. So for those of you who are older, Jimmy Durante, right? We used to think that Rhinophyma was associated with drinking. As far as I can tell, it's not. There are certain bacteria that is thought as well. The truth is, it really is a severe stage of, you know, this type of rosacea. So, so we do see this, and we typically see that more in men. I'm not sure. Maybe I'm not sure if I've seen that in women actually in our practice, but rosacea certainly, but not to that degree. So anyway, I just thought I'd throw my 2 cents in there about that.
Thank you. Yeah. If I do see it on a woman, which is rare, it's typically more mild too. So sometimes women are, getting that Rhinophyma, but typically it is in men. This is just showing a little illustration of the dot laser and, you know, what it's aiming to do, which is heat those deeper layers of skin and create those columns like we were talking about. I also think that there's a bit of a coagulation effect on the, coagulation is where blood vessels get kind of burned out and shrink. And I think that that also provides a bit of improvement for the rosacea type skin as well. If we move on, there are a couple other reasons that we see some redness in the face. There's actually a lot. And so, you know, there's way more than this, but, you know, other than rosacea, you may have some kind of chronic rashes. So a lot of people get seborrheic dermatitis. This is very common, especially across the brow and on the forehead and by the nose. So a lot of times, you know, a patient will come in and say, you know, I have this redness, I want to treat it. What kind of lasers can we do? And something like that is actually better treated with a topical prescription and skincare creams. So that typically comes about in the winter and during times of stress, which, you know, you can't do much about that. But so that's one. Psoriasis, this is a chronic issue that some people are bothered with, some people are not. It just depends on the severity and the symptomatic nature of it. Sometimes it's itchy, sometimes it's not. It can come down from the scalp onto the face, so that's something that doesn't always look as thickened as it does in that photo. It might just be a mild redness that, you know, you're unaware you have. Perioral dermatitis is a subset of rosacea. It does happen to the area around the mouth. It usually will look like a little red kind of discoloration that won't go away. And it is hard to treat if you don't know what it is. So definitely if you're seeing redness in this area, in the folds and around the mouth with sometimes little bumps that doesn't calm down on its own and gets worse with your acne treatments and different things, you want to come see us, because that typically does need some oral medication to shut it down. And then of course, acne. So we're going to go into this further in a later segment. But acne is always going to be, you know, red looking. It can leave red marks, which we want to also avoid. You know, it's hard not to pick, but everybody picks. Dr. Mendelsohn will agree. You know, even if you say you don't pick, I'm sure you pick every once in a while. And picking creates the redness. It makes it worse. It makes it linger. So, you know, we do want to make sure that we control these different skin conditions to prevent any long-term effects, and also, you know, give your confidence back, your bright, smooth skin texture and tone. So those are some common ones. There is another one that I want to mention called an actinic keratosis. This gets confused for eczema, for rosacea, for redness, for a skin rash all the time. And really, it's important to treat these because these lesions can actually progress into a squamous cell carcinoma if left untreated. About 1% of them do. Sometimes they don't ever, but you know, it's super easy to treat them, so you might as well do that. An actinic keratosis looks like a little red flaky patch. Usually they're small. They kind of come and go at first, and you're like, what is that? And why does this redness keep coming up on my cheek? We put cover up, and then it gets bigger, and it stays there all the time. And it just looks like a little red patch that eventually will get a flake to it, a little scale on top of the skin. So what I do in a fair skin individual, which these are more common in anyway, we can use some liquid nitrogen very effectively and safely to treat those lesions. I just use a Q-tip, put it directly on the actinic keratosis. It will freeze and burn that skin layer, the very outer skin layer where these lie, and that typically will take care of them. So sometimes if they're a little thicker, we will use a shave excision option, which is where we take a little injection of lidocaine and epinephrine right underneath your spot. It numbs right away, so all you feel is that tiny first little poke, and then the epinephrine soaks in about 2-3 minutes, and that is what constricts our blood vessels so that it doesn't bleed when we're treating it. And we take a little instrument, this flat blade, and just, we can shave it right off. So a little ointment and a Band-Aid, a couple days, and that's healed over. So an easy treatment option for a lesion that's red, that's not going to go away on its own. So all those different things can create a redness, a red tone to our skin that can be frustrating and hard to cover with makeup. And we want to get you to a point where you don't have to wear as much makeup if you don't want to, and you're comfortable with your skin tone. So just let us know, and we can look and treat you as we need to.
Hey, Hope. That's great. Can you do me a favor? So what with IPL, which is right? So you know, a lot of people come in, they've got this ruddy appearance or these little red dots, like I have, and my dad has, and my brothers have, and you're right, it's and my nephews. So how many? So if I came in, tell me about the treatment. How? When do I need to see you? What can I expect as a result?
Yep. So typically, when you come in, if you have just a couple spots on your nose, we can treat with that little laser video that I showed you before. We can treat just that one area. Or if you have more of a diffuse redness, so more of a redness like I do, the tone on my cheeks and my forehead, we can treat the full face at that time. It takes 5-10 minutes to do the entire face. We can use numbing cream if you'd like to. Honestly, you don't need it. You don't need it at all. It's really not uncomfortable. After we treat you, it might feel like you have a very mild sunburn, just like you've almost been sun-kissed for a day. And you can leave, you can go about your day, you can go run errands or whatever. We just will ask that you wear a little bit of sun protection because you will be more sun sensitive for a couple weeks. And we can give you some sunscreen, wear a hat, just don't be out in a lot of direct sun. And that redness that you leave the office with, that will last about, for some people, an hour, for some people, a couple days. And that slowly fades off, and then you'll see a reduction in your overall red tone or the red spots that we were treating. In about maybe a week or two, you'll see that improvement. Now, if depending on the redness severity and your lesion severity, we will most likely want to treat multiple times. So usually for someone with a diffuse redness on the full face, I'll treat you once a month for 3 treatments or so is usually what we'll start with. You may be happy in 2, and we can save that 3rd treatment for a later date. But you know, you may do 3, and we might say, you know what, we're still not getting the calming that we want. Let's go ahead and do a couple more. So usually we'll start with 3. We'll see how you do. For someone like me with mild rosacea, I like to treat every 3 months. That seems to be my, you know, ideal time frame to keep my inflammation down. Now, to someone with, you know, more minimal rosacea, or theirs isn't as refractory as mine, they might go every 6 months, once a year, and that's fine. Now, with spots on the nose, these can sometimes be almost like a little more deep rooted, and so typically they look a little bit darker red tone as well. Those lesions might take more than 3 treatments initially, but then once we get them down, usually those are okay and they're good until you get more other spots that we need to treat. So it depends on the person and what they've got on their face, on their skin, and how often we treat you. But I would plan on multiple. It's not going to be a one and done thing, and redness in general is chronic, meaning that it does continue to happen. So even if you treat and we get you to a point where you're happy with your skin tone, you're going to want to come back in and make sure that you keep on a treatment plan with us so that we can keep the rosacea and the redness at bay.
So I think it's fair to say that it's very individual. A lot of what ifs, and it depends, and things that I don't think we'll cover now. But you know, the thing I was thinking about is we see so many patients for photo aging and problems with lines and wrinkles, and so we're recommending maybe Retin-A's or vitamin C's. You know, how do those work with it? Does it exacerbate it? Is it a good thing? What is the timing for treatments? And you don't have to answer those now, but I do think that that's probably something that we should discuss maybe on a future segment, or perhaps maybe we find some patients who, you know, if there's anybody out there who has rosacea who wants to be part of this, maybe we can kind of do a consultation and go through that process a little bit. That might be a nice way to show you some of the differences between how we treat these things. So, any other comments?
Yeah. So, does it help if you get treatment early? It just seems like some people let these things go so long that then it just seems like it's harder to treat, like all that stuff on the nose. If you would have treated that earlier, would it have been easier? I mean, I'm just not sure how that works.
That's a very good point. Yes, it's always going to be easier with something that's a chronic condition to treat it when it's earlier and when you have more mild symptoms, because when someone progresses to like that Rhinophyma that you saw in that male, it's harder to treat, and it's more of a process, and it's more a multitude of treatments that we have to combine to suppress. So as soon as, you know, you're noticing symptoms of redness or, you know, little spots like Dr. Mendelsohn was talking about, just let us look at them, and, you know, it's always easier to treat early. Thanks. Same thing with wrinkles. Once those wrinkles get deeper, we got to do more things. We got to do fillers. We got to do more, you know.
We call that prejuvenation. I think that's
Yep.
Yeah. So, all right. Well, that was excellent, Hope. Thank you, as usual. So, Karen, any other thoughts?
Yep.
Okay. All right, good. Well, we will say goodbye for today. We'll be back tomorrow, and we will have more information upcoming with our opening. I just want to remind everybody, if anybody wants virtual consultations, Hope and Karen and myself are doing those. They're working out pretty well. And with regards to May, the month of May, we also have a Botox promotion, $9.99 per unit. And so we look forward to seeing you, and we will be back again tomorrow. Have a great day. Thank you, everyone.
Bye.